Good afternoon. I'm Susan O'Brien at the school-based clinic, currently at Chimacum. I think we're going to talk a little bit about my update later, so I'll just leave it at that.
It's an exciting one. Case.
Yes, Case Kolf. I'm on the board of the Public Hospital District and also at the Port Townsend Eco Village, where I'm the co-founder. And I was recently asked to consult with Celine Santiago on the big project that they're doing there. And I'm hoping that we can have a get together with Molly and Mike to talk about some of the projects that they are very excited about in terms of providing daycare and facilities for very young children as a heart of their 9-acre development here in Port Townsend.
Oh, wow. That's exciting. Ciela.
Hi, everyone. Ciela Meyer, Behavioral Health Coordinator for the Olympic ESD. And I think our big update is that we finally have a student assistance professional at the Port Townsend High School full-time. So we're really excited about that. And she's going to be amazing. And some of you may already know her. She worked for DCYF and for Olympic Angels prior to coming to the high school.
Well, congratulations. That's a big one, Phil. Cynthia?
Oh, I'm not even muted. I'm Cynthia Osterman, board chair at the Benji Project. And I think our big update is that we have begun work on a project with the Port Townsend School District at Ocean under an OSPI grant to pilot new forms of student support and social emotional learning at Ocean.
That is exciting. Thank you for being here. Andrew?
Yeah, hi, my name is Drew. I'm with the Empowered Teens Coalition in Chimacum. Don't have many updates at this moment, but yeah, on April 30th, we do have our drug take back event in Port Hadlock, in Port Townsend, and also in Quilcene area. So
Good to have you here.
Thank you.
Molly?
Hey, it's good to hear from everybody. And Drew, it's fun to see you in a different context.
Yeah.
We were in a, I won't say, but I'm taking the parenting class right now for adolescents, which is super fun.
Neat.
Yeah. So our big update is, I wish Anne was here because she knows a little more about it, but we are working with Children's Hospital on doing what's called Fast A or Fast D, so quick screenings of adolescents for depression, anxiety, behavior problems, and also providing some input to parents as well. Our behavioral health folks are getting that training, I believe, this month, and then we'll start figuring out how to pilot it in the clinic. So it'll be like a quick handoff from the PCP to our behavioral health folks, who will be able to do 2 to 3 sessions with them. So just brief, not for anything crisis oriented or emergent, but a nice way to help take the burden off some of our community providers and provide some more access. So
That's exciting. More will get assessed and more put toward resources. Kate.
Hey everybody, nice to see you all. Kate Dean, Commissioner with Jefferson County. I'd say my update was Molly and I successfully submitted a request for funding in a very short time period at the end of last week while we were both on vacation, I'll add. So fingers crossed on that. And then we're hosting the state director from USDA Rural Development to talk childcare and look at potential childcare sites next week. Not totally related to this group, but we know, of course, upstream.
Upstream, absolutely. Early interception. Denise.
Sorry, I was late. I was trying to settle a WIC issue. I don't know, Susan has an update, I know that. And Lori has an update, I know that. but I'm not sure if I have an update. So I'm just going to say that I am Denise Banker, and I'm the Community Health Division Director here at Jefferson County Public Health, and I know everybody on this call. All right.
Great. Well, we're glad you can make it.
Yeah.
And Tanya.
Hi, I'm Tanya Barnett, and I'm the Family Resource Navigator with the YMCA. And as far as updates, there's a lot. I think one thing just to mention is that we will be receiving an OSPI grant for case management and wraparound services for students in the schools. And so part of that grant calls for some opportunity for family nights in every school district. And so I've already started working with Holly Gum, for example, out in Quilcene about what that might look like in South County. But I will let you know more details as they emerge on that and how that might play into our work. I am doing Kaleidoscope Play and Learn every Thursday afternoon at 3 here at Mountain View, and every Friday morning at HJ Carroll Park. And it is the inner preschool teacher in me is so very delighted. And it's just a really, really great entry point, I think, both for parents and kids. So that's what I've got on my mind right now. And a lot of other things are going on. So thanks for having me here.
Well, that's really exciting. That funding is exciting, and that you're doing something that's really fulfilling is also, it's good to hear. Good to hear. All right. Did I miss anybody? I think we might just go to, we'll start with Susan's news. And Susan, I'm going to share my screen so they can see the slide that you put together. Can folks see that? Okay. And Susan, I'm giving you the floor.
So thank you, Lori. She's the one that did this whole slide. So there was a House Bill 1225, which probably a lot of you gave some input on it, that went through for funding for school-based health centers. And they have 3 pots, one for people that are planning school-based health centers that don't have any yet, people who are starting them. And then there is a 3rd pot for operational and expansion of existing school-based health centers. They give us a very short window, as it seems like these things happen. And Dr. Melinda and I, who are the 2 providers at the school-based clinics, kind of looked at each other and said, you know what, I don't think anyone else is going to be writing this grant. So we tackled that over spring break and rallied and had some wonderful people supporting us. Thank you, Commissioner Dean and others. And Denise was actually really helpful with editing and adding some stuff. So we managed to submit that on Friday, which was the deadline for it. We will find out information about whether we got it or not on the 16th of May. But generally what we decided as our big wish list had to do with expanding our services that we already give. And in particular, Port Townsend currently only has 2 half-days of medical per week, which is the equivalent of what Quilcene does, and it hasn't been enough time. And in fact, students have been going down to Chimacum to get their sports physicals and things like that. So expanding that to 1 day, and then each of the school-based clinics, we requested, our proposal is 1 additional day of mental health services, because every school, every counselor at the school is reporting that they are not able to get in as many kids as they need to for the need. So those are the 2 main parts. So mental health expansion, medical hours expansion in Port Townsend, and then some marketing efforts to increase community awareness of what's happening in the healthcare access. And then we also put in some money for, updating some existing aging or any-fishing tools that we've been struggling with over these years. And kind of interestingly, I think, is back in 2007, which is when we got our planning grant from the Department of Health. The plan was that the next year, operational grants would be offered. 2 of them that we offered for the agency that were furthest along, which I felt pretty confident we would have been one of those 2. But because of the economic crisis that happened in 2008, that never actually got offered. So Gene Baldwin, who was our director at the time, decided to just on a wing and a prayer open them anyway, with help from Jefferson Healthcare and, you know, doing some billing. And so we kind of have struggled along. So 14 years later, now DOH is offering the expansion operational grant. So here we are.
Well, that's exciting. It sounds like it was a lot of work to get it in, but you got it in. Can hardly wait to hear it.
It was neither Melinda or I have ever written a grant before. And compared to what Lori does, it's like a kindergarten project, but it was big for us to get that all in. And so we're pretty happy, and hopefully they'll like it too.
Any questions about that? Now, the additional day of counseling, does that mean that we won't need, there'll be less counseling needed or less funding for counseling needed at our next iteration with BHAC, or no?
Well, this is a question actually for Ciela, because I'm kind of unclear, but I keep hearing rumors that next year we are going to be offered less days / hours than we are now. Is that true, Ciela?
So yeah, so the contract for the funding for next year is 1 day a week for mental health at each of the school districts, all 4 of the school districts.
So in other words, even if we get this grant, it means we're still at where we are right now. It's not really an expansion, because those days are decreasing next year, which is extremely upsetting.
Yeah, Port Townsend and Chimacum, it's going from 2 days to 1 day. And I have reached out to Anna to ask if there's additional funding through, you know, because she said that would depend on taxes. And at this point, there isn't any change. So based on the amount of money they had available to allocate and the cost of services for the 36 weeks, it's 1 day a week.
And then Drew, in the Empowered Teens Coalition, Chimacum, are you guys thinking of continuing the positive action and so continuing the 1 day of counseling at Chimacum?
As far as I'm aware of, we had planned on continuing to do that. I was actually just writing a note to myself to see how we can maybe contribute to this. I'd like to discuss that with you some more. But yeah, if we can help out, absolutely. I hope we can do that.
So that would
Do a
be
little more research on that.
all right. So that would be at least in Chimacum.
Yeah.
But again, even if there's an additional day and Ciela has additional day, that's going to be 1 day less than we have now instead of 1 day more, which is what this grant was trying to do. So if we get the grant, then we're still it's not an expansion. We're still at where we are now, which is,
Correct.
you know, really depressing, frankly.
Could I ask what the cost is of 1 day? I mean, obviously for each school district.
Sure. Per person, it's $500 plus, I think it's $120 for supervision.
And when you say per person, you mean per provider?
So, right. So per clinician, 1 day per week at $500 is what what the contract is. And then that goes to MCS.
And so you multiply that by the number of days that school is open.
Right, so
your
Kate's-
annual.
It's
Case-
1 day a week for 36 weeks at $500 a day, plus once a week supervision at, I think it's $120.
In case that is a special price that MCS counseling has given for this through the OESD, because the Empowered Teens Coalition pays their going rate, which is $600 a day. And so in 3 schools, $600 a day for 1 additional counselor was $72,000 a year.
Thank you.
And we haven't renewed the contract with MCS for next year, so they may require more funding next year just to cover her expenses, because I know that she's been accepting the cost over the years at a loss.
Similar question for Susan. What's the cost for a clinician for the medical piece?
That's a good question. I would have to look and see what for an additional 4 hours.
Let me look at the budget, Susan. I'll pull
Okay.
that up.
Shall we, while Denise is looking for that, is there, so I've been kind of tracking, I'll go back and look at the recording of this, but it seems like this issue is something that we know is going to be hitting us in September of next year, this issue of, and so, and we have a meeting in June, so there may be some steps that we want to set up now that we're thinking through that we can come back to each other with in June. One of which is Drew speaking with Denise and thinking that piece through.
I had another question for Susan. Is this grant going to be ongoing funding if you get it? So every year, or is this just a 1-year amount of
So
funding?
people who are awarded this for this year, they were careful to say, if there's funding, it can be, we don't have to reapply next year, but if we meet the deliverables, that will be offered the following year if there's funding there. That was sort of the caveat, but yes, it sounds like they're planning on doing it ongoing, given that they have the funds. It's not a reapply every year, which is helpful. Denise, did you find that number yet? Okay.
I'm gonna go on to the next slide, and Denise will come back to it just because I know we're always running up against our time frame. So another grant that was put in just this week as well, the HRSA, it's a federal agency, had a behavioral health care services support grant. It was in the amount of $2 million over 4 years, so $500,000 a year. We wrote this grant, and when I say we, it really was, there was a lot of people in on the thinking of it. I especially have to thank Cynthia Osterman, who really crystallized the nugget that we decided to put at the center of it, which is this idea of creating a county-wide youth behavioral health framework that's founded on common approaches and objectives and modalities. And to start that, one of the basic things in the grant is to have somebody come in and help us do an audit or assessment of all of the services across all of the schools and throughout the community. So the folks that are representing here on the YAB, as well as those that are in the schools. And I'm just going to quickly pull up the work plan so that I can overview the work plan as a whole. So we put in funding, there's the base of adding the school districts basically in the form of the Jefferson County Educational Partnership. That's the group that we brought into the Behavioral Health Consortium, because the consortium is who had to pursue the grant. It couldn't be pursued by just one agency. We've put in funding for an audit and assessment study, and then to whatever comes out of that to develop a strategic plan and implement it. So that would be, I think, very much in line with the goals that we have here at the YAB. And all of this is under the greater guise of eliminating suicide and harm reduction impacts with our children and youth. We, in that grant, have allowed funding at about $170,000 a year to fund schools to hire in-school specialists to identify and anchor the at-risk youth while routing them to the in-school administrative, instructional, and behavioral health support services that they need. I think that was part of what encourages the school to come and be at the table as a really invested partner in this effort to create our county-wide behavioral health framework. And then their sort of foundational tasks But one of them was to work with OLICAP to assess what data they have available. And then to, look at that data and come up with a plan of how we would analyze it along with data that the Behavioral Health Consortium is already collecting, so that we might get insights that we don't really have the data to support right now. That wouldn't just help for the behavioral health network. I think it would also help the community at large as we're thinking about working age and senior housing and all of the housing challenges that we have. I think will be supported with data throughout this county. And then another aspect of the grant was to think about infrastructural issues that were challenging folks on the behavioral health front. And we know that one of those is transportation. So there's an element in here to really work with Jefferson Transit and the schools who will also have the private busing system, when you think about it here in the community, to sort of come together and think about how we could be creative in our solutions around transportation. And then the last, or next to the last, is expanding our EMS data collection. And over our past grant, we've only been using EMS data from East Jefferson Fire and Rescue. And now we're going to go up a level and get it from all of our East County side EMS service providers. So that's going to give us, I think, a better set of data to develop better insights. And then the last thing was just to continue the work that our current funding is funding around dealing with jail transitions, facilitating all of the behavioral health summit meetings, keeping track of what's going regionally and how we can integrate with it, doing sustainability and workforce plans, and generally just keeping all of those players at the table so that we're working in a collaborative way to use our funding, our services, our knowledge, our insights, our relationships toward a collective better end product. So that's a quick overview of what's happening with that grant. We probably won't hear until the beginning of August. And so some of what I'm thinking about is how can we prepare for when that funding hits so that we're not spending a lot of months just trying to get our feet on the ground so that we can get the money out. So that's a little bit of an overview. Are there thoughts or questions that anybody has? I should also say Denise edited that thing, and it's a 75-page document over and over. And I want to give a special thanks to her, because those are massive things to do, and it couldn't have been done without her right at my elbow.
Well
That's all
done,
I was
Lori.
going to say.
Yeah, bravo.
Yeah, well done.
I just wanted to ask about the audit. Is there any consultant or I don't know who would be doing the audit, but any identification of who might do that, so that could start early?
Well, so here is, so the next slide that I have is a little bit of a list of things that I think it would be really useful to, sorry, there it is, that it would be really useful to think through. And I really invite this group to help with the thinking through. There is, there's the grant that Susan just told us about, and the question of, are there ways that we can integrate anything there with the work that has been outlined in the second grant? There is thinking about the why expert. And then as I was hearing Dr. Parker speak about the FAST, I wondered if there was something there that we could do that would be consistent in how we're approaching assessing adolescents, but that's just up in the air. And then back to Cynthia's question, I think it would be excellent if we could come up with a group or a game plan for trying to identify who the consultant might be. Of course, it's going to have to go through an RFP process, but could we, is there getting representatives from the JCEP and folks from here together in a subgroup to write what that RFP is calling for? And then is there another aspect of recruiting public health programs, or discovering where it is that we might find the folks that would be worth considering for the role of doing that audit? Thoughts there? Other things, go ahead. Did somebody start to say something? Other things that I was thinking about, I think it would be important for some key representatives from this group to perhaps go and meet with the Jefferson County Educational Partnership at their next meeting. Scott Mock was open to the idea of having it, and I think it would be good to go and just speak with that group about the work that has been outlined in this grant, and whether or not you get this grant. I think that the work plan is a valuable one, and we should look at how we can, as a community, come together with the school districts to execute that stuff. So that's something I think we could be doing between now and then. And then if we did get that grant award, that just how we move the money from the grant bucket into the schools for those school liaison interventionists, I think is an important thing to work out. I think it's important.
I'm hosting the next JSEP meeting, so just reach out to me, okay?
Oh, great. Thank you. And I think it's also important, while we've named a bucket of money for the school districts, I think if there was an agreed to approach among the school districts about how that school liaison role will work and how it is spread across the different school districts, I think that's something that could be worked out before the money actually lands, so that whatever that is, everybody's agreed to, and then we're just getting the money to the right place and getting the resource in. And as we think about that audit or assessment, it seems important to figure out who else should be at this table that we want to make sure is part of that audit, assessment, thought, focus group, stakeholder party. And I know we're at 12:44 here, so we've got 15 more minutes. So if there's things that this brings up for folks, I'm holding it open for conversation.
It makes sense to have DBH a part of that. I don't think they're on this call today.
Yes. Do we want to think about how, I mean, something that came to mind just as Dr. Parker was talking about the assessment tool that they're using, and the fact that we were thinking in our strategic framework about doing, we were calling it the youth expert, right, Susan? Is there, when I started planning for this meeting, I was thinking, what are the next steps to get that going? But now I'm wondering, do we need to step back a bit and see if are these two tools similar? The FAST and the Y-Expert?
They screen different things. So the Y-Expert screens for substance use, and the FAST program is really it's a little bit of screening, but it's also then that quick brief intervention right at the primary care visit and then a handoff. So it's a little bit more than a screening. I'll give you guys the link in case it's interesting to you, but I don't think they overlap, to answer your question. I think they're complementary. Yeah.
Okay, thank you.
The expert actually has a lot of depression screening as well, and brief intervention stuff incorporated in it. So it depends on the tool, but a lot of the tools do have the mental health piece as well. So I'd be curious to kind of see how those compare, because they might be similar.
Mm-hmm. Is there anything that we can be doing now to start thinking about getting that Y-Expert so that maybe we are using it by the beginning of next school year? Is that unrealistic or realistic?
I did finally get a hold of one of my contacts that was not very responsive, and am getting more information. So I'm hopeful that we can have more information, at least by the end of the school year, to start a pilot in the fall. Maybe
in the fall. Okay. So the last thing that we might think about is how then does all of this work that we've identified jive with what is in our current youth age band strategic framework? Because that is while we have been working and going forward, and I feel like we've made some real progress here, is it worth going through that framework with the work plans that we have, both in terms of the work that's funded with Susan's grant and the work that could be funded by this HRSA grant, and see if any of the work that's been done to develop those work plans would translate into the framework that we would then take to the Board of Health for them to approve as the plan going forward. I'm about to pull up the work plan and then the strategic framework and have us look at them both.
Thank
And
you.
you guys can tell me if you need to go away and look at both things before we can really speak to this at all. Let me just pull up the.
Okay, so what's the question exactly again, please?
Well, it seems to me that the work plan that the youth age band framework has a realm of activities on it. Some of them may or may not be things as you look at the work plan that has been set out, for instance, in the grant application. It might be worth looking at the two of those and see what merges and see what maybe makes for better infrastructural pieces to our strategic framework that we would eventually take for this group to the Board of Health to get their approval on, okay, this is what CHIP is going to be working on going forward. So in other words, if we're going to do a behavioral health audit, it seems like that's a big chunk of what we know needs to be done. And maybe takes the place of some of the things that were in the framework that we weren't sure we were going to be able to do because we didn't have school buy-in yet, like some of the training we wanted to do around both kids and staff, sort of mental training on how to recognize and have conversations around mental health challenges.
So basically, what are the priorities for CHIP coming up that we should pull from the framework?
Right. And so give me 1 second and I'll try to pull up that framework really quickly.
While you're pulling that up, a thought occurred to me. I'm looking at the chat and it appears that the amount of money required to increase a few hours or 4 hours or 8 hours isn't as large as I thought I heard it was going to be. And I wonder if it wouldn't be worth approaching, I'm a member of the Noon Rotary, I wonder if it wouldn't be worth approaching the 3 Rotary clubs to see whether or not we can get some support, because they're always looking for good projects.
Case, the numbers that are in there are for an ARNP provider to increase hours. That's not the number for the counselors. The MCS counselors are $600 a day over a year, and by 3 that was 72,000, and so we could divide that and see what that is per counselor. I got to bring a calculator up.
Okay. Well, yeah, I thank you for clarifying that. I just think that we should also see if we can get some local service clubs to be excited about addressing this local need.
Yeah, supporting mental health at the school level is really super important. And that would be $24,000 a year per counselor per school.
For 1 day,
What would
per
be
week.
And Denise, does that include the supervision?
At the rate that Andrew Fetkenbach pays for counseling at the Chimacum High School, yes, that pays for supervision.
And it's about, I think, 22,000 for a day of a nurse practitioner, correct? So 24 for counselor, 22 per nurse practitioner.
Great, thank you.
Case, what do you think would be an amount that would make sense to go forward and ask?
Well, it depends. I know that the Noon Rotary raises maybe $30,000 a year that it allocates to different nonprofit requests. There's an application process. I think the other 2 Rotaries a little bit less, but this might actually be a very there's a brand new president coming into Noon Rotary here in Port Townsend. She has children. We finally have a young president, and she's very excited about looking for some issues that would be fundable during the year that she's president.
Do you happen to know when the timing of their process for applying?
Yeah, unfortunately, we're past that right now. But I'd be happy to talk to Shelley and find out if there's any interest during this next year.
Okay, thank you. I appreciate that. Other thoughts on ways we could make up some funding shortfall?
Well, I just, as a reminder, the behavioral health sales tax funds are done on a competitive basis, and there's more need than there are dollars available. But that is assessed every year, and certainly could put in a larger request. No guarantee that it would be funded, but the group tries to get creative and being fair and distributing those allocations. So I wouldn't shy away from requesting more. In fact, it's really helpful for that board to have an idea of the total need, and effort is put into balancing all the different demands in the community. But I think we should go for the full amount and see what they're able to do.
If we had just a simple one-page write-up of, here's the problem, here's the need, that would be a wonderful way for some of us to reach out so that I'm not screwing up on the numbers or the designation. So that'd be great.
So, okay, an example is for what we're hearing from the mental health people is that they are having to they're out of appointments. And so instead of a student who really needs support every week, they're putting them every 2 weeks to try to make sure they can get everybody in. And they say they could easily fill another day from the 2 days that they are currently. So that's the backstory of what I'm hearing. That's true in all 3 of the school districts.
And given that we're coming out of this period of isolation and youth trauma over the COVID pandemic and what it's done to their schooling, I think the time I think we could really tap into people's collective consciousness of our need to address this issue.
I can definitely work with Susan or whoever would like to work with me to create that one page and get and have it available for Case or anybody else.
That would be great.
All right. Anything else? I'm tempted to let folks go with 5 minutes if there's nothing else.
Do you still need us to think about priorities for?
Well, I would, but it seems like people are going to have to sit and look at the work plan and look at this before it's going to be a productive conversation, and it's 12:55 now. So I can send both of those documents with a little bit of preamble of what I'm hoping we can think about together. I know that there is a long period of time between now and the next meeting, so I'm happy to reach out to folks individually if you'd like. I don't think that we're going to the Board of Health with the frameworks in the near term. So maybe that's what I'll do. I'll send out both of those documents, a little overview of what we'd like to accomplish, and then maybe we can come to the next meeting ready to speak about it. All right.
Great.
Thanks for everybody's time.
Thank you.
Thanks for all your work, everyone.
Bye, everybody.
Bye-bye.
Wonderful leadership, Lori. Thank you.
Good luck to all these grant proposals.
For sure.